Have you ever experienced anything like, when it feels like a curtain's being drawn over your vision?
Oh, wow.
Yeah, I actually have. And it's pretty unnerving, to
Yeah.
say the least.
Yeah.
Turns out it could be something called Amaurosis Fugax. And that's what we're diving into today. We're joined by expert's name. Again, welcome back.
Thanks for having me.
Now, what makes this deep dive so fascinating is that, we're not just talking about like an eye problem. It's a potential warning sign for something, much bigger going on in the body.
That's precisely what makes Amaurosis Fugax so, intriguing. It's like your body's way of sending a cryptic message, a temporary visual glitch that, while unsettling, can be incredibly revealing.
Okay, so let's kind of unpack this a little bit. First things first, what exactly are we talking about when we say, Amaurosis Fugax?
Right. So, in essence, it's a temporary loss of vision in one or both eyes.
Okay.
And I think it's important to emphasize the temporary aspect because while the vision loss itself is short-lived, the underlying cause can be far more serious.
Oh, okay.
Think of it like a flickering light bulb. It's not always just a faulty bulb. Sometimes it's a sign of faulty wiring that needs, immediate attention.
So we're talking about more than meets the eye, literally.
Okay.
So is this where that whole curtain falling description comes from?
Yes, that's a common way people describe the sensation. A painless, often sudden darkening or blurring of vision that feels like a shade being pulled over the eye, almost like you were saying.
Right.
And you're right, this goes beyond just the eye itself. This faulty wiring often points to problems with blood flow, specifically to the blood vessels supplying the eye and potentially the brain.
That makes sense. I remember from, way back when in biology class that like our eyes need a constant supply of blood to,
Yeah.
function properly. Is it like starving the eye of oxygen even for a short period?
Precisely. The retina, the part of the eye that receives light and allows us to see, is incredibly active and requires a steady flow of oxygen and nutrients, all delivered via the bloodstream.
Okay.
Any disruption to this delicate balance, even for a few seconds, can lead to those visual disturbances.
So if we imagine the eye as like a high performance, sports car, we're talking about like sputtering out on the track because it's not getting enough fuel.
That's a great analogy. And just like a mechanic would investigate what's causing the fuel shortage in a car, doctors need to determine why the blood flow to the eye is being disrupted.
Right.
And this is where it gets really interesting because the culprit isn't always as simple as a blocked artery.
Hold on. I thought that's exactly what we were talking about, like blockages, plaque buildup, all that stuff you hear about with, heart attacks. What else could be going on?
Right. So while a piece of plaque breaking off and temporarily lodging itself in an artery supplying the eye is a common cause, it's not the only one. Think of it this way. What IS plaque, really?
Well, I know it's bad, but to be honest, I'm not exactly sure what it's made of.
It's like a buildup of fatty substances, cholesterol, and other things that harden over time on the inside of your arteries. Imagine a pipe slowly narrowing as gunk accumulates inside it. That's essentially what plaque does to your blood vessels. If a piece of that breaks off, it can travel and get stuck, blocking blood flow.
Okay, that makes a lot more sense now. Thanks for breaking that down.
Yeah.
But if it's not just about this plaque, what else could be causing the blood flow disruption in Amaurosis Fugax?
Yeah.
So if it's not just about this plaque we were talking about,
Right.
what else could be causing the blood flow disruption in Amaurosis Fugax?
Right. So the research that you shared points to a few other possibilities.
Okay.
For example, you can have problems within the smaller blood vessels of the retina itself.
Okay.
Imagine those tiny capillaries getting constricted or even, experiencing like a tiny tear that can disrupt blood flow just as effectively as a blockage in, a larger artery.
Okay, so it's not always about this major blockage, but more about where that disruption is happening.
Right.
What are some of the other possibilities then?
Well, we also have to consider the carotid arteries in the neck.
Right.
These are like the major highways delivering blood to the brain.
Right.
And of course, that includes the eyes.
Yep.
So if there's an issue with blood flow in the carotid arteries, it can definitely manifest as Amaurosis Fugax. And then there are, less common causes like inflammation of the optic nerve, or even in some cases, spasms of the blood vessels themselves.
This is making me realize that Amaurosis Fugax is like way more complex than it seems on the surface.
It definitely can be.
So if it's not just a blocked artery, what else are doctors like looking for? And how does this all connect back to those mini strokes you mentioned earlier?
Yes. You're right to bring up transient ischemic attacks, or TIAs.
Right.
The connection is really crucial here.
Okay.
Amaurosis fugax, especially when it affects only one eye, can actually be a warning sign of a TIA.
Really?
You see, a TIA happens when a blood clot temporarily blocks an artery in the brain, essentially causing a kind of temporary system crash, as we were talking about.
Right.
So it's like, imagine your brain as a house with multiple rooms, each with its own electrical circuit. If one circuit trips, the lights might go out in just one room.
Okay.
Similarly, a TIA affecting blood flow to the part of the brain responsible for vision in one eye could manifest as amaurosis fugax in that eye only.
Well-
And what's really fascinating is that studies have shown that a significant percentage of people who experience amaurosis fugax, particularly in one eye, are later diagnosed with having had a TIA.
Wow. That's a little scary, to be honest.
It can be.
Yeah, especially because, like you said, people often just kind of dismiss those, brief episodes of vision loss. So someone might be having a mini stroke and not even realize it.
Yeah.
This makes understanding those risk factors even more important, right?
Absolutely. And, when we're talking about risk factors for both TIAs and amaurosis fugax, there's a lot of overlap. Some are modifiable, meaning you can take steps to reduce your risk, while others are, unfortunately, beyond our control.
Right. Well, let's start with the good news. What can people do to, minimize their risk? I imagine, like, a healthy lifestyle goes a long way.
You're absolutely right. Yeah. Many of the modifiable risk factors tie back to heart health in general.
Okay.
So avoiding smoking, maintaining a healthy weight, getting regular exercise, and eating a diet low in, saturated in trans fats are all really crucial.
So those, late night cheeseburgers might be doing more than just expanding my waistline.
Right.
But what about the things we can't control? Like age, for example. I'm assuming that's a factor.
Yeah, definitely. Age is a significant risk factor, particularly for those over 50. Additionally, having a family history of stroke, TIAs, or, cardiovascular disease also increases your risk. And then there are certain medical conditions, high blood pressure, diabetes, high cholesterol. These all play a role in making those blood vessels more susceptible to problems.
It's definitely like eye-opening, no pun intended, to realize how connected our eye health is to our overall health.
It really is.
But let's say someone's listening to this and, maybe they have experienced these like fleeting vision changes and they're thinking, okay, I need to get this checked out. What happens then? Like, how do you actually diagnose something that by its very nature is so temporary?
Right. You've hit on a crucial point. The sort of ephemeral nature of amaurosis fugax makes diagnosis a bit tricky,
Right.
but certainly not impossible. The first and most important step is seeking medical attention immediately after experiencing any sudden vision changes.
Okay.
Don't wait for it to happen again.
So no toughing it out or like hoping it was just a one-time thing.
Exactly. Time is of the essence here. A detailed account of what you experienced is really key. Which eye was affected? What did the vision loss look like? Was it a curtain, a dimming, a complete blackout? How long did it last? Were there any other symptoms? This information helps your doctor piece together the puzzle, so to speak. They'll also want to know about your medical history, any family history of strokes or heart conditions, and your lifestyle habits.
It's almost like playing detective, isn't it?
It can be, yeah.
Trying to piece together clues from this like fleeting event.
Right.
And then I imagine they'd want to like actually look at the eyes themselves.
Absolutely. A comprehensive eye exam is a must.
Okay.
This allows the doctor to check for any abnormalities within the eye itself, like damage to the retina or problems with blood vessels.
So looking for any lingering signs, even if the vision has returned to normal at that point.
Exactly.
And what about those like underlying causes that we were talking about? How do doctors determine if it's plaque or a carotid artery issue or, something else entirely?
That's where things get really high tech.
Okay.
One of the tools doctors use is called a carotid Doppler ultrasound. Imagine it like a sonar for your arteries. It uses sound waves to create images of the carotid arteries in your neck, allowing doctors to see if there's any narrowing blockages or plaque buildup.
Oh, okay. Yeah. I've heard of those being used for like heart health too, right?
Exactly, yeah.
So it makes sense that they would be helpful here as well.
And depending on the suspected cause, your doctor may recommend additional tests like an echocardiogram to check your heart's function, a blood clotting profile to assess your risk of blood clots, or even an MRI to rule out any issues within the brain itself.
Wow. Okay. So that's quite the arsenal of diagnostic tools.
It is.
So once the cause is determined, what does treatment for amaurosis fugax look like? Like, is it as simple as, taking an aspirin a day?
Unfortunately, there's no one-size-fits-all answer. Treatment really hinges on what's causing those visual disturbances in the first place. If it's determined to be a blood clot, blood-thinning medications or aspirin would likely be prescribed to prevent future clots. If significant plaque buildup is detected in the carotid arteries, surgical procedures like carotid endarterectomy, where they go in and clean out the artery, or carotid stenting, which involves inserting a tiny mesh tube to prop open the artery, might be recommended.
So it can get, pretty involved depending on the severity.
It can, yeah.
But I imagine those like lifestyle changes that we talked about earlier play a huge role too, right?
Absolutely.
Like not just treating the immediate issue, but, preventing it from happening again.
Exactly, yeah. Managing those modifiable risk factors is key. Controlling blood pressure and cholesterol levels through diet, exercise, and medication if needed is crucial. For smokers, quitting is often the single most impactful change they can make.
Right. It's all about taking that kind of proactive approach to your health.
Yeah.
Both for your eyes and, your overall well-being.
Precisely, because, as we've uncovered in this deep dive, those fleeting moments of vision loss are often a message, a warning signal from your body that something needs attention.
Such an important takeaway. So if our listener remembers just one thing from our deep dive into Amaurosis Fugax today, what should it be?
Don't ignore sudden vision changes, even if they seem minor or disappear quickly.
Okay.
It's always best to err on the side of caution and seek medical attention. After all, those few minutes of discomfort from a doctor's visit are a small price to pay for safeguarding your sight and overall health.
Great advice to end on.
Yeah.
As always, fascinating discussion. Thanks for joining us for this deep dive, and we'll catch you next time.
Thanks for having me.